The Centers for Medicare and Medicaid Services, or CMS, released the proposed calendar year 2023 Physician Fee Schedule, or PFS, recently. This rule would greatly increase access to mental health services, accountable care organizations, or ACOs, cancer screening, and dental care, especially in rural and underserved areas. In this part 1 of 2 video, we will talk about mental health services, colon cancer screening, and global surgical services. In the part 2 video, we will discuss the evaluation and management changes and split shared services. So be on the lookout for that one. Let's prep with a little background information, shall we? The proposed rule for calendar year 2023 PFS is one of several proposed rules that are part of a larger plan by the administration to create a more fair healthcare system with better access, quality, cost, and innovation. Since 1992, Medicare has used the PFS to pay doctors and other billing professionals for their services. Services from doctors that are paid for by the PFS are done in many different places. Medicare pays doctors and other professionals a single rate for most services given in a doctor's office. This rate is based on all the resources that went into giving the service. Payments are based on how much time and money are usually put into providing the service. Each service, practice expense, and malpractice expense is given a certain number of relative value units, or RVUs. With the help of a conversion factor, these RVUs are turned into payment rates. Geographic adjusters, the Geographic Practice Cost Index, are also added to the total RVUs to account for different practice costs in different areas. When figuring out payment rates, an overall payment update that is set by law is taken into account. So what's new? Before I answer that question, for the newbies in the room and maybe not so new, let me say, hey there and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. Oh, and don't forget to hit the bell for notifications of my weekly videos. You'll want to stay in touch. So, in the 2022 CMS Behavioral Health Strategy, CMS set goals to remove barriers to care and improve access to and the quality of care for mental health and substance use. To help with the severe lack of mental health professionals, the agency wants to let licensed professional counselors, or LPCs, marriage and family therapists, LMFTs, and other types of mental health professionals and allow them to offer mental health services under general supervision instead of direct supervision. These are more like incident to a physician or qualified healthcare provider. Also, CMS wants to pay for clinical psychologists and licensed clinical social workers to work as part of a patient's primary care team to offer integrated behavioral health services. CMS is also thinking about putting some chronic pain management and treatment services into a new monthly payment. This would make it easier for patients to get comprehensive, team-based treatment for chronic pain. Last but not least, CMS wants to pay for opioid treatment and recovery services from mobile units like vans so that people who are homeless or live in rural areas can get to them more easily. I love that. Colon and rectal cancer was the second leading cause of cancer deaths in the United States in 2020. Colorectal cancer death rates were higher for Black Americans, American Indians, and Alaskan Natives. CMS is proposing that a follow-up colonoscopy after an at-home test be considered a preventive service. This would mean that people with Medicare wouldn't have to pay anything out of pocket for it. Also, Medicare wants to pay for the service for people who are 45 years old or older. This is in line with the United States Preventive Services Task Force new lower from age 50 age recommendation. CMS wants to hear what people think about how to improve the valuation of global surgical packages and pay more accurately for them under the PFS. Comments are being accepted until September 6, 2022. So you have learned that the 2023 PFS proposed rule has been released, and you have also learned what is being proposed for mental health, colon cancer screening. You have also learned that comments are being requested for global surgical services. And lastly, you have learned that all comments on any part of the proposed PFS rule are being accepted until September 6th. Questions of the day. Did you know that this information was released? What do you think about the proposal? Do you think they will be helpful in coding? Let me know in the comments below. I would love to hear your thoughts. Well, my final thoughts. Well, this is the time of the year where we receive all these gifts of various changes being proposed. The great thing is that if you feel strongly in favor or opposed to anything, you can use your voice and comment. Also, now is the time to prepare yourselves on what the final rule may look like. I only talked about a few items, but there are several. I have included a link to the proposed rule. Check out the description box. So check it out and get prepared. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or a question. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at prncoding.edu. Let's stay connected and connect others. Well, you have stayed until the end. Thank you. Let me know in the comments where you are checking in from, and let me know if you have specific questions or items you would like to see discussed here on our channel. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.